Hello and welcome to this week's episode of Two Southern Nurses, Doses of Wit and Wisdom, brought to you by Plain Speak Productions. Here are your hosts, Donna Parker and Tammy Clark.
Hello, and thank you for stopping by to visit Two Southern Nurses, Doses of Wit and Wisdom. My name is Donna Parker. I'm a registered nurse, a certified case manager, and I'm here today with my friend, peer, and nurse extraordinaire, Tammy Clark.
Thank you, Miss Donna. I'm Tammy Clark. I'm RN BSN, 30 years of experience. We're here to be an encouragement to all of you. We know there's a lot of new nurses out there we're seeing some negativity on some of the sites, and we would love to have a way to encourage you about this field, educate you. I encourage you how to improve you being a better nurse, how to avoid the negativity and the burnout, and know that some things are just normal in any business. So we're so happy that you tuned in with us, and we would love you to like and subscribe on our different sites and join us every week.
Yeah, weekday, share. And the nurses, the caregivers that have been there for a while, let's spark that excitement. What got you into it? Some skills you might not have learned, some things you want to improve on. We're going to hit on all that. Between us, 65 years that we can share experiences, miracles that we've seen. There's a lot of positive in nursing.
Yes.
There is negative, and we will touch on that, but we don't want to focus on the negative. We want to focus on the good and taking care of each other,
right,
and ourselves. We have to you take care of ourselves before you can take care of others.
That's true.
So definitely tune in and catch us on social media, and we look forward to you being here with us.
Residents with respect and dignity.
I want to kind of go into that, like the eye-to-eye contact.
Yes.
Speak slowly and clearly so they understand you.
High level also.
Right.
Don't constantly be over someone. Yes, because that makes them feel like you're dominating.
Yeah.
You're in control.
Yeah, and you're in the personal space.
Yeah,
we all have our personal.
Yeah.
And the other thing to touch on too is this is their home. If they're in long-term care, even like in the hospital.
Yeah.
This is considered their home, and you're in their home, and you need to respect that.
Absolutely.
So, yeah. Slowly, clearly, privacy, always.
Yeah. Entering their home, you knock on that door.
Yeah.
And you walk in there smiling, greet them.
Yeah.
Greet them with their name.
Yeah.
Introduce yourself. Make a expressive effort to show them that I am washing my hands. You want your resident
to know.
Because if they live there, really even patients in a hospital, if you come in that room, patients know now and residents know now. You're supposed to wash your hands. So if you do something wrong like that as soon as you enter, they'll say, I need to see your manager.
Yeah. Could you, it's like a bad
nurse-patient relationship.
Yeah.
I mean, that's when you're establishing the trust too.
Yeah.
And so that nurse-patient relationship, that's where it starts. And I just find that you've got to do all those things right. It's little things. But this is what
they make up. That's
being big. First impression, right? How often do we go with those first impressions?
Lots.
Now, nurses, we do that first impression.
Yeah.
But we don't let it affect our face.
Yeah.
And we just keep going.
Yeah.
Well, if they're angry, we just
try to diffuse that.
Absolutely.
You got to communicate.
Try to be happy.
Yeah.
Is something bothering you today? Are you okay? Are you in pain? Is it physical?
Pick up on their body language.
Is it mental? Yeah. And then a lot of times they'll say, well,
this is going.
My son just called and my dog died, or my son just called and my mother died.
Or I just went to therapy and I don't think I can do this.
Right. This is too hard.
Yeah.
This is too hard for me.
Yeah.
It hurts too much.
Yeah. Okay. So we need to talk about, do you need pain medicine? Are you taking pain medicine before you go to therapy? Let's talk to the therapist. Are you getting a good warm up before you start therapy? And what are you doing afterwards? So on body language, what they're telling you, take a second to listen.
Right. And thank goodness now with therapies of any kind, if you're an inpatient, they can actually put on your schedule, because, everybody has their own schedule for the day if they're in therapy or something. They could actually schedule rest periods in between.
Right.
That way, if it's a pain issue, then they can give you your nurse can give you your pain medication an hour before you're going. You know when you're going.
Yeah.
And on top of that, you do have that rest period, so that I can't do 3 hours of physical therapy in a row. Obviously, no, but it's okay. We can schedule the rest periods in between each hour, and make sure that your nurse knows. Your nurse does know your schedule, but, accentuate to your nurse that I need my pain medicine every hour before I go, and I had my rest period. So,
yeah,
they have a responsibility too.
And that gives them an opportunity to see how effective that was.
Right.
If it wasn't effective, then we need to communicate that with the prescribing docs, right?
Yes, the doctors can actually write that to allow for rest periods in between each therapy. And that gives them that sense of control. I'm participating in my care, but it also lets them know we care. We're willing to work with what's not working for you.
Yeah,
because unfortunately, it is kind of shifted a little bit as far as, like we talked about earlier, it's not all about the patient first anymore. And I really feel like if you listen to what we're saying, remember, it is 30 years of experience for us. Well, 60 years between over that. So if you'll listen to us, hopefully even nurses' negativity, can understand, well, maybe I need to change what I'm doing.
Bring some light
to make it better.
Self-reflection.
Yes. And, because we're going to talk about, at the end of the day, if you're not happy.
Yeah. Your mental health is as important as the patient and the family's mental health, because it's all a system.
Right. If you can't relax, recover, renew, you need to take some days off. You're working 7 days straight. You're working 16-hour day. Whatever it is, you absolutely have the right to say, no, I can't work that overtime day. Yeah. Even though you I got to pay my bills.
But how many times have we also had those couple minutes of, let's do some deep breathing together to help calm you down? So we take those cleansing breaths too, and it gives us the opportunity to say, okay,
lowers
my
heart rate,
everything,
pressure, and stress level.
And you're breathing through it with them. This is a coping technique that you can use anywhere,
right?
So that they have a tool now in their toolbox, right? Because we want to fill up their toolbox with tools they can use and know how to use, not just tools that are there. And somebody says, deep breathing. Well, do you breathe from the top of the chest, or do you get all the way down? All the way down,
Right.
And just for those couple of minutes, you just got to relax and let your mind go and recenter and get a new start.
If people knew how effective deep breathing was, they don't realize it's nature's beta blocker. It really does. It lowers your blood pressure. It lowers your heart rate. Well, you lowers your heart rate, so therefore it brings your blood pressure down. And same thing with beta blocker. It's meant to lower your heart rate. And in turn, it calms you down. The anxiety.
And the respirations too. If you're Right. You're going to calm down all those accessory muscles, reflexes, anxiety, fight or flight.
That's it.
Right. We're calming down. And believe it or not, the person in the bed, if you're a facility, is listening next door. Maybe they're doing some deep breathing too. Maybe this person's been so anxious, let's make them anxious.
Oh, yeah.
Right. So there's always somebody listening, and there's always an opportunity to teach. However small that is, and document that. We talked about deep breathing today. A resident showed symptoms of anxiety, increased respiration, talked about heart being beating fast, feeling her throat, sweat. Okay.
They're anxious. I'm anxious. I have an anxiety. That's a big topic. Even, for me, mental health awareness.
Absolutely.
Because anxiety is a big factor in our society due to, a lot of things, but COVID brought a lot of these issues to light.
Yeah.
So, it's okay. We know how to take care of that.
Yeah.
Not just medication.
Right.
Yes, medication. But let's try some of those basic things first.
Yeah. Some behavior.
Meditation day, right?
Let's journal.
We can meditate.
Yeah.
We can pray. We can. You have to find.
Yeah. Pick up the phone and call a friend.
Oh yes.
How awesome is that when you call and say, listen, I just need to talk, and then whether it's a peer that understands your job, right, a nice friend or somebody else in the field, or it's a good friend that doesn't know anything about your job and they just sit there and they go, get it out.
Yes.
I understand. I don't understand, but okay.
Okay.
Then, do it.
Yeah.
Do it.
We typically have that one person at least that we can always go to vent.
Yeah.
It might be mom, dad, sister, brother. It might be best friend. Might be your nurse colleague.
Yeah.
It might be your trainee, or it might be your mentor. So,
or my daughter. Now she's grown up with me in the nursing field, right?
Yeah.
So she was born into right after right before I graduated nursing school. So she understands a lot about the healthcare that typical 30-year-olds don't understand.
She lived it.
She's lived it.
She's lived it
from the family
She's
side.
never known any other way.
Right. Mama's been a nurse her whole life, and she'll go into the pediatrician's office and she'll start asking questions because we've already discussed it before she got there, right?
Yes.
Like she asked this, and they'll say, "No, but my mom." She'll say,
and we're trying to keep it a secret.
"No, but my mom." I grew up. My mom has been a nurse forever, and they'll say, "Well, that's right. She's right." She'll, or they'll say, "Well, she's a little ahead of herself. Let's try this." Because Mama wants to get everybody fixed.
Mama does fix everybody.
That's right.
In her eyes.
That's right.
In your daughter's eyes.
That's right.
Mama fixes everybody.
So,
and if I got a problem, I'm going to ask Mama.
Right. Yeah. We got to consult before you even got,
Yeah, that's right.
Yeah. So, we're talking, dignity and respect. Again, continue with the foundations of nursing as we did in our first episode. And we also want to talk a little bit about respect and dignity, the professionalism parts. Not just nursing, but the healthcare team. We got a lot of ancillary folks, respiratory therapists, physical, occupational, speech, dietary, social workers. We all have that professionalism responsibility to the community and the people that we serve, because we all serve the patient. We are here to take care of them and work as a team for that. Mm-hmm. And so one thing we want to talk about is just from the very get-go, you're going to knock on that door for you, come in the door, right? Mm-hmm. Give them a heads up. Hey, somebody's getting ready to come in.
Yes.
Even if we're sharing a room with somebody, give that knock and say, "Whoop, get ready to come in the door."
Well, you've got to remember, when you are in that interdisciplinary team within a facility, regardless of the type, we've talked about it takes a tribe.
Yeah.
It takes a village. But I'm going to step up a little bit and say the nurse really is the center of that, because we have to coordinate all of them.
Yeah.
Now, the therapist can come in and give their care plan for that patient. Occupational, physical, speech, social worker, caseworker, finance. Everyone puts their portion in there, but the nurse has to do that 24-hour a day care plan. Yes.
Care coordination.
Absolutely.
Yeah. And maybe the doc prescribes something and we're looking through all the medications for the day, getting everything set up, and we're like, "Ooh, person is allergic to some. Oh, they didn't catch that, right? So we're kind of the eyes and ears. We're the backstop, double check.
We are for the other members of the team.
Yeah.
Because, I mean, the pharmacy is all over the building. And I've had many of those. Oh, they're allergic to Tylenol. And I'm supposed to give them Tylenol every 4 hours.
Or I go up to look at allergies and there's nothing listed.
Right.
Oh, man.
But they tell me.
Yeah.
Right?
Yeah. So then you got to stop, trust, but verify.
You have to.
So then you go back through medical records and you're looking for that documentation, and then you got to correct and Fantastic. We didn't cause any harm to the patient. We have to make sure, just check but verify, or trust but verify.
No. And if I want to be the nurse's cheerleader, I can say, by you stopping and verifying that, you save the patient from an emergency, a potential medical emergency, but you also saved yourself a whole lot of extra work.
Absolutely.
I mean, I don't want to
Medication care.
I don't want to do COVID.
No.
I mean, what if they had an anaphylactic reaction, to something that they're, and some patients, a lot of patients come in known allergists, but they've never taken this medicine before.
Right.
It's never been on their profile. They didn't even know what it was. They never heard of it.
Yeah.
So this is the first time they're taking it.
Yeah.
So, and what about all these injections we give? I mean, vitamin injections.
Yeah. What are the side effects?
Vaccinations.
Yeah.
We do all these things a lot of times within the hospital. It's flu season. Well, we ask everybody, do you want a flu shot? Yeah. I mean, what if they've never I never taken it before. It's the first time. Pneumonia shot. Yeah, you typically don't take it unless you have comorbidities and the other part of that, comorbidities, but you also just now are 65 and older, right?
Right. So we've not had
I'm not taking the pneumonia shot, but I'm a candidate because I have these comorbidities. First time I'm taking it, though.
Yeah.
So.
And we need to educate about that. If you start feeling weird.
There you go.
If you start itching, throat itching, tongue feels thick, eyes is itching.
All right.
Please hit that call bell and call me right away because we'll have to give you something. And the nurses, we don't just need to sling pills all day. We've got to know what we're giving that patient, and then what is the did we get the desired effect that medication is for? And if not, we need to communicate. Whether it's psych or the nurse practitioner or medical doctor, hey, so-and-so has taken a statin. This is the 3rd day, but now their urine is brown. Oh, man. So we have a potential for that, right?
Yeah, absolutely.
So, that's a big deal. Let's stop it. Let's hydrate this patient, make sure there's not been any kidney damage. But if my nurse doesn't know that, if my CNA doesn't know to report, hey, their urine's changed. Right? Because our CNAs are our eyes and ears. Well, hey, they're not peeing as much. Oh, well, yesterday they hardly peed. Today it's brown. Please talk to your nurse and let them know, because then we've got to get busy so there's no further damage done. And that's going to be an allergy.
Yes,
right?
yes. Yeah.
So communication, education, and know your meds and side effects. And we're going to talk about medication administration, reconciliation, what happens when they go to the hospital and come back to the facility. Did they rewrite all their meds? Did that get put in correctly? Did they change a dose and somebody forgot to adjust it? Eyes and ears, double check. You're the safety guard for your patient. And we're going to talk about some of the, especially some of the major medications we come across, antihypertensives and diabetic medications, and all those things that vitamins. Do you take vitamins water soluble or fat soluble? Do you take them with food or without food? Well, how many times have we seen a whole cup full of pills popped at one time, and they'll give them this little cup of water, they'll chug that down, and then I'm fine. How many times is those pills probably sitting right there, right? They've not washed all the way down. Then they're going to start dissolving, and we all know how nasty that is. And then all of a sudden, your patient says, "Ooh, I got the awful heartburn." Or they're puking up pieces of pills, right? Because it's so irritating to the mucosa. So We want to talk about proper administration, hydration with that. You don't do grapefruit juice with some meds, right?
No.
We need to know which ones you can do.
It's hypertensives.
No grapefruit juice. So, and then what about the ones you can't crush?
That's it.
Right.
Yeah.
You got to know which ones you can crush and you can't crush.
And if you don't, call pharmacy.
Your pharmacy's your best friend.
They are.
Medications. And you will have some cheat sheets for that.
Oh, yeah. In the med room, they'll put up these big things. And
Yeah. And depending on, most facilities now are digital electronic medical records, EMRs.
Yeah.
And there should be some educational where you'll be able to pop on that little thing and it says, oh, this is an antihypertensive, should lower the blood pressure, then it monitor this, that, or the other. And we'll talk about those monitoring for the correct medications. If you're giving somebody an OL and we start monitoring the heart rates being 40, 44,
Right.
oh, we might need to hold that and call it stop. Because otherwise we're going to be doing a code.
And that's another benefit of the EMR.
Yeah.
And now, on those EMRs, you pull up the patient's profile and they're on a LOL, and in the little box instructions, it'll say, hold if blood pressure is less than 60, right?
Right. Systolic less than 60, diastolic less than,
So
heart rate less than.
Yeah.
Right.
So some of those majors, it'll,
Yeah.
I mean, that's like,
And before we were thumbing through the med book while, and we have them highlighted and sticker noted.
our
And
nursing bed.
yes, back in the day. And so now all that's digital now, and that's resources that we want to make sure everybody's aware of.
Right.
So because a lot of it's free, and
Right click, and then it come up, all the information.
Yeah.
Mm-hmm.
Education for you, education for your patient.
That's it.
And our newer nurses, of course, now they're talking medication assistance, right? Some facilities are training the CNAs to be medication administration assistants.
That's true.
And so the benefit of the podcast and our upcoming videos and all that good stuff is we're also talking to the CNAs that are trained to be medication assistants, because you are getting ready to come into a pharmacology world that you have had no exposure to.
Right. About 6-week program. Is it even a 6-week?
I don't even know if it's 6 weeks. And that's a lot to be responsible for. That's a lot for your nurse to depend on you for. And all the things that the nurses, that falls underneath their license, and they're responsible for you.
Mm-hmm.
And you better know what you're doing, or everybody's going to be in trouble. So we'll talk about medication administration and the safeguards and all the things that go with that too.
Oh yeah, there's a booklet.
Yeah,
I mean, there's so many no's and very few yeses on what a CNA who's been a CNA for a year and shows ambition to progress her career and has the motivation to do that,
and the cognitive ability
into it. But
some folks have the desire and not the ability. And so where do we need to, if you want to work in the healthcare, maybe nursing at the bedside or CNA is not the position for you, maybe we need to look at activities or restorative, or there's somewhere that you need to find your niche, but you don't need to make it something that you're not, trying to be somewhere that you're not made for. And not everybody's made to be a nurse.
No.
Right.
I mean, I know at long-term care, even physical therapy assistants, they would choose some of the CNAs that have been CNAs for 30 years, 20 years. And what they would do is say, would you be interested in ambulating our ambulatory patients with a walker, or getting their walking, with the safety belt? Yes, absolutely.
Yeah.
They, would you like to work with us?
Yeah.
And you would be considered a physical therapy assistant. I guess they do call them physical therapists,
because the assistants,
PTAs are
they've got some education behind their minds,
experience.
Yeah.
And they've had a lot of transferring patients, knowing the right and the wrong, using the lifts, using a lot of their physical therapy equipment.
Yeah, especially if we've got a weak side. Maybe they've had a stroke, there's been an accident, an amputation. Something as small as toe amputation will throw your gait off.
Oh, yeah.
So you have to relearn those things, the balance and such.
Yep.
And definitely ambulation. And that's some of the skills that we, of course, Tammy and I came together during testing for CNA testing certification here in the state of Tennessee. Tammy was an instructor, and I was the RN observer for the testing. And it's been 3 years, I guess, since it all started.
More than.
Okay. Yeah. So that's kind of how we got together, and seeing the 20 skills that were assigned, they're randomly assigned to the students. But the missteps and some of the not knowing why, not even how, but why they were doing certain things, we've seen the need and realized that it can span across all levels of caregiving, from home to the hospital. We've got several nurse friends, over the years. It's hard on their bodies too. So I've got a friend that's had knee replacements. She did not start out as a CNA. She went straight into nursing, and she's like, I wasn't quite sure how to transfer. I needed therapy to remind me, right, good body mechanics. So sometimes, even though we go in and we're the patients and oh, you're a nurse, you know that. Not necessarily.
No.
Not everybody has learned the basic fundamentals of activities of daily living. And so we know, we're not hopeful. We know that it's going to help.
That's part of that foundation.
Yeah.
That's a foundation of your skills. You can have a foundation of skills, foundation of professionalism, foundation of
knowledge.
Ethics, all of it. Yeah. And that's how we, that's firm foundation.
Yeah.
You keep building your whole career.
Their whole career.
Yeah.
It doesn't stop.
No, it never stops.
Never stops.
Because we're constantly learning.
Yeah. And technology is changing so much.
Oh, yeah.
I mean, back in the day, we would write.
Oh, paper and pencil.
Oh, please. And I knew who worked before me. I could tell by their handwriting.
That's right. Right.
I worked with a nurse in the burn ICU, and it looked like he'd been typed. Everybody knew whose handwriting that was.
That's unusual.
It was the most detailed. There was no question about what happened to her patient that night. And then you'd look at the next entry, and it'd be 2 lines. And you're like, oh, I wonder what happened that night,
Yeah.
So we used to document full documentation.
Yeah.
And then it went to exception only. And then it went to the check boxes, right?
Yeah.
And now we're electronics, the grids and electronics, from a Cardex to
tab, cardiovascular, tab, neuro, tab. Yeah.
And even with that, you can't look at the whole patient. With our Cardex, we could.
I know.
But you look at the whole system. With my report sheet, honey, I knew every patient, the whole system.
I don't think I could have done my job without my Cardex.
I couldn't have.
Because I don't think do they even use them now?
I don't think so.
I use my Cardex for my report in the morning, and I would write out my report from the previous shift on my Cardex.
Yeah.
Because I knew this Cardex is going to be with me all day long.
Yeah.
It tells me the labs they need done. It tells me anything.
Yeah.
If they're getting physical therapy, they're not.
What kind of diet they're on.
Yeah, everything.
Yep.
So how they transfer. So, I mean, their allergies. So I don't know how it's done. I know when you pull up the medication profile, it'll say allergies, weight, height, but it don't tell me how they transfer. It tells me their age.
Yeah. Well, the one facility I worked in, they had a notebook of the care plans for the patients on the unit.
Right.
And so if you were assigned bed 1 through 10, you had your 10, and you would kind of have that plan of care summary to let the CNAs know, they're on a pureed diet, they're on bed rest because they've just had a hip fracture, they need a bed bath today, da-da-da-da.
Yeah.
So that was kind of an overview for the CNAs, and I could look through that pretty quick, and especially if I was transferred to the floor, floated to the floor, didn't know.
Right.
Do they take the pills whole or crushed? Do they speak Spanish? Am I using an app talk to
the
them.
phone back then, right?
Right.
Phone translation.
Now it's,
You'd have to call the number.
Yeah, right now well, back in the day, you're hoping that the family was there,
Yeah.
So
That's true.
now you've got...
They're open for a phone.
Right.
But those services are available too, because I remember us calling over and saying, hey, we need someone who does sign language because we have a deaf patient coming in and we need to provide that service to them while they're in our facility.
Yeah.
And they provided
that. Yeah.
They provide Spanish translation.
Russian. I've had to use Russian.
I've used Russian. What's that? I can't even remember. I can't remember.
Yeah.
But yeah, we've. I mean, I was shocked.
Even in workers' comp, I have several Hispanic folks in the North Georgia area, and some of the providers will go to the office and they bring in this rolling computer, and the interpreter is virtual, and they will sit there and transcribe for you. Interpret what they're saying, and then they'll interpret what the doctor has said back in Spanish. It's fantastic. And then you get a printout of the conversation to turn into the adjuster and say, this is what happened, this is what was said. It's fantastic.
Oh, yeah.
I was impressed.
Well, being in a classroom, you have those classroom rules.
Yeah.
Well, you know that I had a Ukrainian student come in. And him and his family did escape the war when it broke out.
Yeah.
So that was a few years ago, but, that's how he got here. He was sponsored from an American family, and they came over.
Yeah.
He came through the CNA program. Now, his experience was amazing. He was like a paramedic, had some pre-med, medic in the Army, or whatever Army he was there.
Yeah.
Had a lot of experience. He could have done a lot more than, CNA skills that, our scope of practice.
Yeah.
But he came through and he could not speak English.
Yeah.
And, me, first day, I'm just talking, explaining the program. And, I hit the subject of cell phones. During class, these have to be put away. They cannot be sitting on the desktop, because as soon as they light up or vibrate, your focus changes.
Yeah.
And we don't have time. We got to learn all this stuff, right? And everybody put their phones away, right? And then there was a box sitting at his desk. And I'm like, you're Victor? And he said, yes. And he said, yes. And I said, we can't have cell phones. And he said, no, cell,
Yeah.
And I'm like, can you speak English? He said, little. Like, how am I going to do this?
Yeah.
Because the skills test, the knowledge test is in English. The skills test, you have to verbalize everything you're doing.
Yeah. Yeah.
And I thought, how am I going to do this, Donna?
Yeah. Yeah.
Call Donna.
Yeah.
How am I going to do this, Donna?
One of us speak Ukrainian.
No. I wish I had.
I do too.
But it's kind of like I told the whole class, y'all have to be a village.
Yeah.
He's got to learn to speak English in four weeks.
Yeah.
In 4 weeks, he takes this test with the state, and he did it.
He did it.
How?
Yeah.
Because,
He worked very hard.
He rose above the barrier, right? Language barrier. We hear that all the time. But this was truly a language barrier, but he adapted. He would go home and he translated the mock skills booklet into Ukrainian.
Yeah. Yeah.
And then after learning it in Ukrainian, then he would come back and learn to say that word.
Yeah.
Privacy. He'd pull the privacy curtain, but he'd just say privacy. That was enough. I called Donna. I said, Donna, is this enough?
That's enough.
He's saying the main word, safety, handing the call light. So, I mean.
He knew the skills.
He knew them.
Yeah. Yeah.
I mean.
Absolutely.
That's first time.
Yeah. absolutely.
He passed the first time.
And he really didn't struggle. It took him a little bit longer.
Yes.
As you could tell, he was confused. The word was coming to him, but
yes,
he didn't run out of
he
time.
had to process as he was
really
doing the movements.
Yeah. I'd like to know on some of our folks, what have they done? Are they still in CNA? Are they going on to nursing school? You know, what does they go afterwards? Maybe we need to do a survey or something. Where are you now? You know?
Absolutely.
That would be awesome. That would be awesome.
That might be a call-in day.
Yeah.
Did you go through the CNA program? Did you go through a nursing program? And where are you now? And maybe
what was the best thing about it that you would like to share?
Right.
You know, or what did you wish you would have gotten out of it? Maybe we need to focus on things that are missing that people are struggling with when they come out of the facility or out of the training program. And that's funny because we had talked about some of the ADL skills is incontinence care, right?
Yes, yeah.
So for state, you know, that we've got this mannequin laying there and it's all nice and clean and just plastic and all, and going to use your soap in your water. But what happens when it's the real world and this patient's been on lactulose and you come in and there is an explosion and a puddle of poo, and you're like, oh, where do I start? That's what our poor new CNAs walk into,
and they don't know,
unfortunately.
And I say, what do you do? That's one of those questions I ask them.
Yeah,
what we're doing. Oh, you've walked in and they have soiled themselves. What is your next step? Well, I'm going to start no, we're not going to start pericare. We're actually going to clean up the soil, because if you try to do pericare with the soil underneath them, that's contamination.
Yeah. You're going to give them a urinary tract infection.
Yeah.
Right.
Well, lactulose.
Yeah.
Dripping off the bed.
Yeah. Oh, yeah.
Or, I mean, it's front, back, sides.
Right.
Yeah.
You're going to do a whole bed change. You're going to do you might even head to the shower.
That would be a good idea.
If they can get on the you know.
Yeah.
But we want to talk about those things is the reality versus the textbook, I guess. Experience versus the textbook.
Yeah.
You know, if oral care, and we're just in here with these clean little swabs for state tests, but when you get in there and you're doing the real deal and you start pulling out chunks of food and parts of pills and you see them light clack on the tongue, these are things, because we're always observing, right?
That's right.
Always got to observe and communicate with our nurses. Hey, there's something going on in room 364. Can you come take a look?
Right.
You know, when you get a chance. And so
oral care is
huge.
Is those basic.
Yeah.
That's personal care.
Yeah.
I mean, that's...
And how do you feel when your mouth's all clean and fresh? You don't want to be sitting there from the night before and have dragon breath when you get up.
No.
And people start shoving pills in your mouth and they're wanting to feed you, and you're like, hold on a minute now. I got to get this mouth taken care of first.
Yeah, I've actually had a doctor write mouth care before each meal at bedtime.
Yeah.
And we're like, a doctor wrote that we need to do mouth care before it increases appetite.
Yeah.
To stimulate your appetite.
Absolutely.
So do mouth care 1 hour before each meal, and it will stimulate their appetite, especially when they're not eating.
They're not eating.
Or drinking.
Yeah.
Because they have a bad taste in their mouth.
They might have a bad, or a sore.
Yeah.
Or a bad tooth.
Yeah. Thrush. Yeah, absolutely.
All of that.
Candida. Yeah.
All of it.
That's
yeast. You know, Lord, you get a yeast infection, you're just...
I know.
It's wrong.
Nothing tastes.
Nothing tastes good.
No.
So definitely. And then, of course, our teeth, you know, we get this infection. We have the potential of having a systemic infection, right? Right.
All the way to the bone.
All the way to the bone.
Yeah.
And
that's true.
So our teeth, very important. Oral care, very important. Hydration is part of that. And I've learned more recently, continuing to learn, as a workers' comp nurse and visiting with ENT specialist in Rome, Georgia.
Yeah.
I have a gentleman that smushed his face on the steering wheel and he's crushed all of his sinuses. Well, he never had sinus problems before, but he welcome now, you know, and with the pollen and everything on top of the injury, he ended up in the ER with our sinus infection. So the ENT is like, Navage. He really promotes that Navage over the neti pot, because the neti pot puts the fluid in there, but it doesn't pull it out.
Right.
And the Navage pulls it out. So you don't have anything stagnant sitting in there. And then he talks about saline, normal saline spray to help keep the mucosa moist, and blowing your nose regularly, which we talked a lot about after COVID. Please make sure you patients blow their nose, because this is your filter for your lungs, and we don't want we want to keep our filters clean and moist so it can do its job. So I didn't really realize how much the hydration and the mucosa played into sinus infections, breathing problems, irritability with the ears, all of that, and so I was like, that makes sense.
Well, that's the example of we don't always need a pill.
Yeah.
Yeah, we need to know basic hygiene for the nose, then the sinuses, right? Yeah. The mouth. I mean, it means a whole lot to do. That's the personal care, ADLs, the basics. That is the basics. Yeah. But yeah, saline. Yeah. I mean, that's a saline solution. It's an antiseptic. It's gonna put that salt up in there, which is going to kill a lot of bacteria other than flushing it out, right?
Yeah. And that's what he talked about. He's like, antibiotics, they kill the bacteria, but they don't help with the phlegm and the snot and the rubbery stuff.
No.
You got to have hydration.
It's still right here causing problems.
And it's going to cause another infection if you don't get it out. And so I thought that was fantastic. I'm like, just nasal spray. He's like, I'd be out of business if everybody used nasal spray in the Navage.
There you go.
There you go.
Words of wisdom.
Words of wisdom.
And education.
That's right.
Education experience.
That's right. So that's always something I push with my folks is hydration.
Yeah.
We don't. I would say just about everybody I know is underhydrated, not necessarily dehydrated, but do you drink the 1 ounce per pound of body weight that you have every day? Most of us do not.
No.
Right?
No.
So hydration, our body is 60-70% water.
It is.
Right?
Depending on our age, Donna.
Yeah, well, you know.
Mine is only 45.
Right.
But yeah. But, yes, with any age.
Yeah. And that's part of that comfort for your patient. Before you leave them, whether they're at home or you got something to drink, let's make sure you got something fresh to drink. You can reach it.
Right.
And I want to have all that drink before I get back here and check on you.
Well, it's not, right?
Yeah. You got
all this mucus. How do I get rid of this thick mucus? Well, let's hydrate. Put the water in. It'll liquefy these secretions. And yes, you can blow it out.
Yeah. And I've got you some tissues right here. Your garbage can's right there off the side of the bed.
Yes.
Let's get it out of there.
Yeah.
You're going to feel 100% better. And not laying flat. Folks feel better if they're up. That helps all that drain down. If you're positioning and you've got them laying on their back flat and all this is just stuck here, that's hard to breathe.
Yeah.
So let's elevate them, decreases risk of aspiration, increases GI motility, and helps that drainage come down so they can get it out.
Yeah. And, in a real world, this is gross, but in the hospital, they can't get up and run to the restroom and cough the stuff out of their throat and spit it out, right?
Yeah.
So if it's draining, right? I mean, I wouldn't tell them to swallow it. Provide a disposable cup with some tissue or tissue at bedside, a disposable cup.
Yes, your little emesis basin.
Oh yeah,
the little pink emesis basins. They're rounded so they could put it under their lip.
That's true.
So if they can get it out, you don't have to use suction, then get it on their own.
Yeah.
Then, put that little pink there, put some bunch of tissues, let them do their thing.
Yeah.
You come in there every now and then with your gloves on and throw that out, give them some hand sanitizer, and they're going to, right?
The suction is another thing.
Yeah.
I mean, that we have in the hospital.
Yeah.
They may not have it at home.
Yeah.
But in the hospital, that's just another tool that you can use. Say, don't swallow that. When it starts to come up, you can go down to the side of your mouth and suck some of that up and get that out. If you can't cough very effectively.
Right.
But then you want to teach them how to
cough and breathe. Instead of spirometer. And if you don't have incentive spirometer at home, let's talk about that cough and deep breathe and pulmonary toileting. And holy cow, we know a lot of stuff.
You think?
I think so.
It's like I said, it's many, many years of learning.
Yeah.
Not that we always did it correctly.
Right.
But we allowed ourselves to continue to learn over the years. And I think that's what unfortunately, I think nurses are getting discouraged early in their careers saying, this is not what I thought it was. This is not for me.
Right.
And Yeah, I think unfortunately that's what.
Is that because they're being rushed out from the textbook and not getting to spend time on the floor in a true orientation program with somebody that wants to orient, a mentor that is a true mentor, an advocate for them, and to walk them through it from A to Z. You know, you be my shadow for the next 4 weeks, 6, whatever your facility allows, and don't allow that person to, say the mentor gets called in sick. What's going to happen to that person? 9 times out of 10, they're going to be stuck with somebody that don't want mentor
to talk to them. They slow me down. I can't have a student. I can't have a new nurse. Those kind of things.
Yeah. So we definitely got to look at the orientation, and then are our programs talking about reality versus the textbook? Incontinence care example, like we talked about earlier. What is it going to happen when you're out there and now you've worked so hard for this certification, for this licensure, for this specialty, and you are now responsible? And there's a difference between knowing and doing the things that you know best how, not knowing I've learned it and now I know to go forward. But it's bad when you know and you don't do it correctly, right? Then we're looking at standards of care, professionalism, scope of practice, all these violations that go against our nursing promise, our pledge. Just like dogs, our patients come first. We are the caregivers. We are the healers at the bedside. And if you're not willing to take on that responsibility, this may not be the spot for you, right?
But if you want to learn,
we're definitely here.
But you don't know everything.
And you're not going to.
No.
It's a continuous thing.
No, I'm still learning. I'm learning.
And as you expand and go from floor, try different floors. Maybe you like oncology. Maybe you like OB. Maybe you like labor and delivery. Maybe you like stroke unit. Maybe you like trauma and burn. Whatever gets you in there, learn the medications, the processes, the procedures, and don't feel like you're locked in. Maybe you want to hit all the ICUs. Every one of them has something different to teach you. Specialty centers, long-term acute care, Shepherd with a traumatic brain, all these things that we can get into. You don't have to be stuck in one position in nursing. And so we're here to talk about experience from the get-go and everything that we have experienced over the past 30 plus years, in addition to skills that you need to make you a better caregiver and maybe a better recipient of care, because we want to teach the patients how they can help you as a caregiver to help themselves to be most independent they can be. And back again to that dignity and respect. We're all human and we want to be treated like humans and not numbers and another stroke, here's another diabetic. No, they're not conditions. They're all people.
They're not room numbers.
And they're not room numbers. Yeah. So that's where we'll leave it today. And we're going to be looking at getting some more recordings out. We're working on our videos. We've got so much in the process. Please, if you know somebody that can benefit from what we have to share, somebody that wants to learn more about taking care of themselves and others, like, subscribe, share, and we will be having some contact information if you want to be a guest on the show, if you have a topic you want to talk about, any of that stuff, please submit it, and we look forward to hearing from you. We're going to be just a teaser. We do have some props that we're going to be having some participation requests from the audience. Maybe we need some names for our guys here because we're going to be using them during some videos and educational pieces. So if you think of those, anything good, that would be good for our props. That would be fantastic too. Until we see you next time, thanks again for stopping by. Two Southern Nurses, Doses of Wit and Wisdom with Donna and Tammy.
See y'all.
This podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other healthcare services, including the giving of medical advice, and no doctor/patient relationship is formed. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.